morning, everyone. I'm pleased to introduce our speakers for today's FHS seminar entitled Public Health Education in a Context of Multiple Crises, Dr. Sausan Abdelrahim, Dr. Tamar Kabakian, and Professor Judy Makhoul. The global public health community has been grappling with an array of challenges in the recent years, from the ongoing COVID-19 pandemic to the protracted crises and conflicts affecting many regions worldwide. Against this backdrop, our speakers will share insights and experiences from the public health education programs at the Faculty of Health Sciences, which may offer valuable lessons for shaping global public health education. They will particularly be presenting selected exemplars from the graduate FHS public health programs, highlighting the development and the adaptation of the courses as part of the public health in conflict and protracted crisis certificate, the integration of public health, artistry in scientific public health and in ever-changing global context, and finally, the role of public health education in promoting peace and preventing war using public health framework. So we hope that this seminar will provide valuable insights and inspiration for those involved in public health education and practice, both locally and globally. And now, without further ado, the floor is all yours, doctors.
This is the last time that I will present in the seminar, I promise you, this year. You've seen me a couple of times already. What we're going to present as a group is an adaptation of a panel that we applied for at the American Schools of Associated Schools and Programs of Public Health Conference held last week. So this is an adaptation of it. We presented it a month ago to an audience in the US, and today we're presenting it to you here. So what I'll present on specifically is a course that was developed and given to graduate students on forced migration and humanitarianism. And basically the purpose behind developing this course is to prepare our graduates to work in the humanitarian context and with forced migrants in Lebanon. I want to start by saying that this course on forced migration actually had a predecessor, a course, an elective course called Migration and Health that I started teaching in the faculty as an elective. So it always had a small number of students taking it. And it was basically on migration and health, not forced migration and health. A lot of the literature on migration and health actually is from context in the global south, in the global north, and high-income countries in the global north. And most of it focuses on labor migration or voluntary migration, not on forced migration. This material adapts from the sociology of migration, which has roots in the economics of migration or social networking and migration. And much of it also addresses the racialization of immigrants versus the assimilation or integration of immigrants. On the surface, this body of literature is very different from the forced migration literature. The articles that were used in this course come from sociology journals, public health journals as well. And you will see that at that time, the forced migration articles came from mostly humanitarianism or from refugee studies or refugee law types of journals. Also, in the course on migration and health, we engaged a lot in issues related to access to health for immigrants and how the health of immigrants changes over the course after their migration, and specifically the literature that highlights how the health of immigrants actually deteriorates over generations after migration rather than improves. Okay, so that was a course that was given pre-2016, and at that time, this was the early years of the Syrian crisis, and the arrival of refugees in Lebanon. Lebanon has always had refugees, but at that time, the students were asking, why are we only focusing on migration and health? Why don't we engage with forced migration and incorporate into the course readings and material on refugees? At the same time, well, not at the same time, but I'm sorry, but at that time, I mean, we all know that starting in 2011, the Syrian crisis started after, after the Arab Spring and the revolution in Syria that descended into civil war, and then there was the arrival of refugees into Lebanon, Jordan, Turkey, and other countries in the region. This unfortunate situation actually led to the availabiliabty of careers for some of our MPH graduates. Quite a few of our graduates, starting with 2013, 2014, started to obtain jobs in the humanitarian sector with UNHCR, with other international humanitarian organizations. So this was it was an unfortunate situation, but it provided careers for our students graduating from public health. However, there were challenges that the graduates faced. Some of you here in the room attended a meeting that CPHP organized with some of our graduates who were working in humanitarian organizations and the challenges that they were facing. The first was that they are not prepared to actually work, that the courses they take in evaluation and research design, they don't prepare them to work in a humanitarian setting, that they become trained on the job, and this training is mostly technical training. They are provided with some manuals like the Sphere manual or the MIST manual, and they're asked to read it and then apply it on their job. And they've also complained about the fact that all the decisions were made by expatriates, and they were the implementers on the ground. The situation has changed a little bit since then. That's when, at the same time, a group of people in the faculty, some of them are here in the room, started to meet and to develop a certificate of public health in conflict and protracted crisis, an academic certificate. It focused on conflict and protracted crises rather than on forced migration, but you'll see that the forced migration course is a piece of that certificate. So just a little bit of information about that certificate. It's for MPH students in any concentration in the faculty. So it's not a program or a concentration, it's above and beyond the concentration. And what the students need to do is they need to take 2 electives on either forced migration, on war, or humanitarianism. And then in addition to the 2 courses, they need to carry out their integrative learning experience project and their practicum project on issues or in an organization that conducts issue or deals with issues related to conflict, humanitarianism, or forced migration. So some of our students did their practicum, for example, or their ILE projects with UNRWA, the United Nations Relief and Works Agency, the ICRC, ANERA, American Near East Relief Agency. These are the sites that I remember right now. And some students actually did their ILE on projects that the faculty are conducting as well. So forced migration is a course that's one of the elective courses in the certificate. Initially, it used to be called Forced Migration and Humanitarianism, and then it was split because it wasn't covering the learning objectives completely. So it was split into 2 courses, a 3-credit course on forced migration only, and a 1-credit module on humanitarian methods. So let me say just a few things about the forced migration course that was developed really for the purpose of preparing our students to start to think about forced migration, the context of forced migration in the country that is unique. And in fact, a few years earlier, particularly the students coming from the US, we had a cohort that had 3 or 4 students from the US in the same cohort, and they all expressed that we could have gotten this MPH anywhere. in the US, and the fact that we are here in Lebanon, we really expected to be trained or to engage with material related to the context in Lebanon, and not just the generic, the typical courses that any MPH program offers. So slowly, the course on migration and health transformed into a course on forced migration and health. The course has a philosophical orientation, which is about justice and equity and rights for all refugees, irrespective of who they are and where they end up. So the course does not address practical considerations about, a country has to return refugees because they can't deal with them. It's really a rights-based approach to forced migration. It is an academic course. It's not hands-on or a technical training. So the technical training, those who work in humanitarian organizations will get it, or they'll get some of it actually. Currently, they get some of it in the humanitarian methods course. But the forced migration course is really a social sciencey academic course on forced migration. It's multidisciplinary, so the students are exposed to historical, legal, and social readings on forced migration, and in some cases even literary. So they read a novel by Ghassan Kanafani, for example, about smuggling, a novel on smuggling. And the course offers a critique of the international refugee regime. So it starts out with the history of UNHCR and the 1951 Convention on Refugees, but then immediately after, in the second session, we start critiquing basically an international regime that was developed in the following World War II in the 1940s and 50s, and start to talk about its inapplicability in the context of the region where a lot of the refugees are an outcome of ethnic strife or civil wars, and they end up in countries or in context of countries that have not signed the 1951 convention and are not obligated to abide by it, including Lebanon and Jordan. So the course is not only critique. I mean, the course also provides information that is new to the students, but also it critiques. I mean, now it's very trendy with the, what is it called? The non-binary in some gender studies. It's very, it's in vogue to critique every categories and binaries, and the literature on migration and refugees has historically focused on two categories that are completely different, that the refugee is very different from an economic migrant. But in recent years, of course, there's been really interesting studies that have really critiqued that approach, which comes out of really practical considerations by UNHCR and other international organizations, because they don't want everyone to identify as a refugee because of limited resources. But there are interesting critiques of how these binaries or categories have really stymied or impacted our ability to understand people's lives on the move. This is actually a title of a book, Migrant, Refugee, Smuggler, Savior. And these are categories that are defined and written about differently in the traditional literature, that actually really, the lines are really blurry between these categories. And then on the other hand, it focuses on continuities between, so for example, climate refugees are first internally displaced populations, and then they become refugees, and they become labor migrants in some cases. And then also the continuity between trafficking and smuggling, and the relationship between refugees who reach out to smugglers but then end up in trafficked situations. One thing that we do every year in the course is we adapt the course to the needs of the students. So every year we have some scholarship students from Africa, a couple who take the course as an elective, and we integrate readings on internal displacement in Africa, or actually on the legal aspects of migration in Africa. And then last semester, there were 2 students from food sciences or agriculture, so we integrated some readings on agriculture forced migration and precarious work. And there's every week the students, there's a newsroom, so the students post a news article on a current event, and we try to link that to the readings in the course. The course is also organized around case studies. Of course, being in Lebanon, the two main case studies that we talk about are the Syrian refugees in Lebanon and Jordan. And this fits very well along the lines or in the content of the course that is about basically the very thin line between forced and labor migration and how refugees work as seasonal migrant workers, how seasonal migrant workers then also become refugees. And the Palestinian refugees, of course, is an important case study that we address in the course relating to protracted displacement and its impact on basically the system, the refugee system around the world and its impact on protracted displacement. But we also address case studies from Africa and from Latin America, for example, internal displacement in relationship to development projects in Africa, the Nubians, and in Latin America, a big issue that has been going on is unaccompanied children who cross borders and their protection. And finally, not finally, this is the slide before final one, but we also engage in up-to-date debates in the course, and every semester the readings change because the course incorporates readings from 2022 or 2021, and the issues that we addressed last semester is decolonization. So everyone is talking about decolonization theory right now in health, in sociology, and anthropology. So we address decolonizing of the knowledge on forced migration, the labeling and categorization. Again, this fits into the binary and categories. An important issue in the last couple of years is offshore processing of asylum and how it impacts the human rights of migrants, climate refugees. And then in recent years, particularly as an outcome of the global impact on refugees, there's been this push for the migration development nexus. And there are really important critiques of why the World Bank and others are pushing for development projects rather than humanitarianism for refugees in different countries around the world. Finally, I just want to end with this slide on engaging students outside the classroom, because this is something that's very important for a lot of courses in the faculty, and it's CEF likes to see that. However, this is the last time the students were engaged outside the classroom pre-COVID. And of course, COVID and the economic situation has impacted the ability to go out and spend time. But the questions that are important also in a course on forced migration is, why do we want to engage students outside the classroom? What do they gain from it? And what do the communities that we take the students to benefit from it, and how to do it, and also with whom? So before COVID, engagement outside the classroom was always done in organizations rather than taking the students to a refugee camp to see refugees and then come back to AUB. So this is in UNRWA, in one of the UNRWA schools. So I think just in a course like forced migration and engaging students who are interested in this issue outside the classroom, this is something that needs to be really well thought of and not just taken for granted that it's always good. So I'll stop here and my colleague will continue.
Okay. Yeah. Thank you, Sophie. So I'm going to reflect a little bit on work we've been doing in the graduate program, looking into what we called, the artistry in public health, which goes hand to hand with the science we learn in public health. And I'm going to drive you through the thinking process and what's happening in our program. So in general, when you look at the literature and you look at the skills, any program, any, any degree will give you, they might be characterized or categorized as hard skills and soft skills usually. So hard skills are very much connected to the competencies in the program, and they are measured through the tests, through the evaluations that are linked to the courses that are assessing these competencies. On the other hand, the soft skills are very much acquired silently through the program, most of the time silently. And it is not definitely specific to any profession. So they're not specific to the competencies that are generalized as, social skills, communication skills, emotional skills, intelligent study skills, cognitive skills. And it's important to differentiate them from the psychological traits of students. So, for example, someone who's communicative doesn't mean that that person necessarily has an effective communication skills professionally. So this is not about, personal characteristics. It's more about the skills you learn through going, through acquiring the competence in the program. So how much of those soft skills actually are done intentionally and are integrated in programs was basically the question we were asking in higher education. So we looked into the literature on this, and there's a lot of literature that talks about the importance of these skills for employability in any careers, in any professions. Some of them would be more important than others, but they're always there in the literature with very clear association between these skills that applicants might show and the employability prospects of these graduates. And also in another group in the literature, you can find a lot of readings on study skills and the importance of these study skills as they are integrated into programs. There's a lot written on how do you critically appraise skills within a profession if you're learning it in English, for example, and your first language is not English. A lot of interesting stuff to read there. How students develop study skills, time management, reading skills, writing skills, all of that goes hand in hand with in every program most of the time in higher education. However, in public health in specific, although there is some acknowledgement of these skills in the workforce, but not in programs. So we have something like core competencies for public health professionals. However, there's a general gap in public health education, but also beyond, when we want to understand on how do we implement practically the integration of these kinds of skills within higher education programs in different contexts. Now, also the literature is very rich in labeling these skills. So I was till now calling them soft skills. But in the literature, you can also see other types of labels like life skills, 21st century skills, transversal skills, transferable skills, generic competencies, and so on and so forth. For our purposes, we actually decided to call them essential skills. And the main argument is that these are considered to be crucial for public health practice, for the application of the competencies which constitute the science of public health in the field of public health. And they should not be considered as an additional to the specialized skills. This is why we call them essential skills. And from now on, I'm going to actually continue by referring to them as essential skills. We also think that, not only think that, we know that this is somehow the invisible curriculum, something which is not very clearly referred to and evaluated, and it goes a little bit beyond the curriculum. Also, our previous work on the art of public health, which I'm going to come back in after my next slide, also informed us a lot about the scope of these skills and the application of these skills and the importance of these skills in the practice of public health. Now, why were we very much interested to understand what are the skills that are necessary to go hand in hand with our graduate program? It's the contact mainly. And, my colleague Sausan started talking about how the context came forward to inform us about what kind of courses or content in courses need to be developed over time, but also how the program develops over time is very much influenced by the context and the multiple crises that we are going through. And I mean, we all know this is not new. This has been, there for a while, and it's not something that we're gonna, get rid of soon. So it is important to think about the set of skills that would be important for public health professionals to have in actually practicing public health in such context of multiple crises. The social media campaign that we did a year ago, and we called it "This is the Art of Public Health," actually was very informative in opening our eyes towards these skills that are important to practice public health in the field. And in this campaign, we have featured a number of people who we call them champions, who were practicing public health from different walks of life. And not all of them had, a formal public health education. However, they were all using the artistry in public health. So the set of essential skills to be able to implement and practice the science of public health in the fields in which they were practicing and making a difference in their own communities and making a change in their own communities. You can see their stories on our website if some of you are interested to look more into this. So what we did is that we started looking into where these essential skills are in our program, what type of skills are already there in our program, and we embarked on a mapping exercise to do that. And the faculty members might remember, FHS faculty members in the room might remember, we did present in a faculty meeting on this mapping exercise that we did. So we wanted to know what was happening beyond the, how were these essential skills were given in the courses beyond what were taught in these courses. And we did a mapping to see where these were introduced, where these were reinforced. Some of them were even assessed and how they were assessed. So we started this mapping exercise, which is still ongoing. And that also led us to think about what are the essential skills that are important in our programs, what we're covering, what we need to cover more, and to think about this comprehensive list of essential skills that would be important to work on and integrate into the MPH program. So this is an example of part of the mapping we completed. And then with deliberations and discussions within the faculty, with different faculty members, and with the information that we got from the mapping exercise, we developed a set of essential skills that we thought are important to document and to make sure that we put processes in place to integrate in our curriculum. And, I have them in two columns in here. The one on this side in black fonts are different from the one on this side in red fonts. And the difference is basically that these ones here in black fonts, you're gonna see them as a lot reported in the literature and quite generic, and they are part of, any kind of program, and they need to be developed in any, degree throughout going in higher education. As a student, we need to develop many of these skills, and they need to be integrated and really well integrated in programs. Now, the importance of these ones, the red ones, are I want to highlight because these are things that are of high relevance in our context, and they need to be defined, contextualized, and operationalized in a way that can be applied in our context. And this might be different in different contexts. So what is diversity? What are the diversity aspects of importance in our context? And how do we approach that? What are the social norms related to that? And how do we, incorporate that understanding into our teaching and learning? Public health ethics and their application in the context of multiple crises becomes another important issue to always discuss and integrate and incorporate. What is cultural competence and how does it affect communication skills? How it should be, reflected in communication skills and otherwise in our work, in our research, and all of that. Conflict resolution, definitely there is a competency on conflict resolution in our program. However, that is very much at the interpersonal level. How can we go beyond the interpersonal level into intergroup conflict? What are the root causes of conflict? And this is something Judy will pick up in her presentation next to talk more about the role of our programs in actually addressing conflict aspects and different aspects of the conflict. So these are things that we still need to reflect on and think about where this could be integrated in the program. How can we capture them? How can we integrate them, but also evaluate them? And, as I said, make them there visible for faculty members and for students. So the next steps would be to emphasize the linkages of these essential skills with competencies in the program with different course content and make it that visible for instructors and for students to benefit from this course. And then we need to find creative ways and pedagogies that would help us for making durable integration of these essential skills in our programs for the years to come. Integrative method and interactive methods, new approaches, new pedagogies, capacity building maybe for us as faculty and for the staff working with us. Also, it's important to think about this as a comprehensive approach, which goes beyond just the curriculum and the program, because you need also institutional support. So you have writing centers, you have libraries, you have a lot of units that need to work together in an institution to make a durable change and integration of these kinds of skills into the program. I'm going to stop here and give it to Judy to continue.
Thank you very much. Thank you, Tamar. Thanks, Hassan, for setting the stage for what I'm going to talk about. This is something that has been in my mind for some time, and we've had some sort of a small discussion about how can public health education have a role in promoting peace and preventing war, rather than just waiting for wars to happen. And as Amy Hagopian says, mop it all up. So this is very quickly my presentation. I think I might need my glasses. All right then. Okay, so this presentation will actually just give a quick overview. We'll ask us to pause for a moment and reflect for us to see whether or not we should be taking action. And even though some examples will be coming out from our context, this has a lot of relevance to the global context, not just in places where there is war, but also in places where there is peace and where war is supported from other countries. So many of us have lived through the war in Lebanon, the multiple wars, starting from the civil war to the Israeli attacks, the multiple Israeli attacks in Lebanon, and recently the Beirut blast, but also the repercussions and what happened after these wars. And as you can see here, this is just a small map of how the cluster bombs have been planted all over the place in Lebanon. And even after the demining and the cleaning up by various organizations and UN agencies, we still have a lot there. And these are causing a lot of death and disability, especially in areas in the south of Lebanon. The Beirut blast has also created a lot of death and disability and severe injuries in Beirut, but also outside of Beirut. And this is not something that is new to us, and everyone knows the implications and the repercussions of the Beirut blast. Which include death, disability, destruction, the Ds, but also the mental health problems for people in Beirut and outside Beirut, the harmful effects of the toxins, the environmental pollution, the hospital damages themselves, including the healthcare staff and the mental health problems that they have endured as well. And the wars in the Arab world, taking it outside, a little bit outside of Lebanon, is not a thing, it's not a recent thing. Wars have been part of the history of the Arab world. And over the past 25 years, half of these countries have actually witnessed wars, and many of them are protracted and ongoing and continuing. and infighting and fragmentation, including the ISIS war and all of this. And we have also seen the recent and continuing escalation in the Israeli-Palestinian conflict, which seems to never end. And we all know the consequences of armed conflict in general, but for our area, it has been including, in addition to disability, trauma, infectious disease spread, environmental degradation, and damage to our own institutions, whether they be formal institutions or informal institutions, I mean, families and networks. But it has also, we have also seen damage to agricultural lands directly being hit and directly being targeted. And also the water and irrigation systems in areas of the region, which has definitely impacted vulnerable children and many populations, and also displacement camps, especially in Syria. Now, if we were to think about wars and how to address them, or even think about how to prevent them, we need to understand what are the causes of war. And so the causes of war are multiple, and I sort of wanted to group them into two categories. First of all, the culture of war, which actually has become rampant and present, ever present. And it relies on the discourse that wars are necessary for people to continue living, because there are limited resources and nations need to struggle to control these resources. And of course, then also healing is necessary, and armies are supposed to be doing that. And armies are portrayed as a very noble institution. Of course they are, but we always seem to, and I'm reflecting on the Independence Day. So Independence Day, you have not just army celebrations, but you have children wearing army suits. And then this is part of the culture where what the army does is supposed to be supported blindly by people, but also it gets also infiltrated in the education system. So this is part of the normalization of ideas related to conflict and militarism. In addition to that, you will see that the media has a very important role in propagating these ideas and focusing on issues related to war that can actually lead to igniting different kinds of conflicts as well. On the other hand, you also have an ideology of war. You have political, economic, where nations and groups are interested in political expansions and conquests of resources, of lands, of water. And perfect example is the state of Israel that has benefited from all of this. You also have another important thing that we seldom think about is social inequity within populations and between countries that have spurred. So recently, the Arab Spring, there was a lot of social inequity, and people started to go to the streets to rebel. And when this happens and there are arms around, then you definitely have armed conflicts. In addition to that, wars are usually very beneficial for those who profit from the war. The arms industry, the nations that sell these arms, and also the nations that buy them. So we see between the 2015-2019, for example, the importers included a lot of nations, a lot of countries in our region, the Gulf countries, and also Israel, as well as in the Middle East. You can see the exporters were also coming to us from Russia, from the United States, and China. and of course, Israel. And you can see also, it's very interesting to see that the weapons that the ISIS forces were using came from different places of the world as well. And this is just a small table that I always like to, and it gets updated. If you look at the highest ranking arms industries, you can see they are situated in the United States, China, and the United Kingdom. But the arms industry doesn't just produce arms, it also contributes to social development and programs in education, which are very much a conflict, pose a conflict of interest. How can industries that create conditions for and fuel war and injury contribute to educating people about life skills and social development, and contribute to community development issues? And so these are just some examples of the major industries of the projects that they have, and they are also contributing to community investment programs, citizenship, promoting education, careers, and all of that. And stay tuned for next week. We'll talk more about commercial determinants of health and how they have a conflict of interest as well, also in contributing to these kinds of programs, while at the same time they are health harming. If you look at what's happened in Syria, just for an example, you can see, look at all the kinds of arms and the weapons that have been used. And these, if you calculate the amount spent on the Syria war, tens of billions of dollars, and that would have been used in different ways to improve the social development of the country and to reduce the inequities there. As public health professionals, what we do usually, and this is what we see is being done, we mop up. And I thought this is a very interesting way to start, to continue the discussion. So we accept it. There's a very interesting chapter in this book, Preventing War and Promoting Peace, edited by Wist and colleagues, 2017. And there's a very interesting chapter that talks about how academia has bought into doing this. And I thought that's very, very revealing. So if we read this book, it tells us how we are, as academics, as academia in general, buying into what's the status quo and supporting even, because we are not political enough to advocate against this. And I'll get to that in a moment. This is a very nice book, and it's in the library. It's an ebook. So very quickly, what Sausan has discussed is just an example of a course. We have the conflict certificate, right? So if you read through the competencies of the conflict certificate, they're very much what Tamar was talking about, the science of the technicalities and how to do this and how to do that. Very nice, very important. And also the CIF accredited program that we are part of also is very strong on the core competencies that are in these areas, right? Of evidence-based approaches, healthcare systems, leadership, communication, you name them, we have them. However, there are no foundational competencies related to prevention of war and promotion of peace. And we are in so much need of this in our parts of the world. And we can do a lot, and it can be integrated, and it's not difficult, okay? We have a lot of focus on the science of public health, and very little, as Tamar was telling us, focus on the essential skills related to the art of public health. But also, whatever we see here is from what I think is very apolitical. It's very a shy stance. So we are not aggressive enough in doing what we should be doing to promote peace and prevent war. It does require a lot of effort, or some effort at least. Can we do this? there are windows of opportunity. And I'm just going to go over very quickly what I think and what has already been talked about in a number of books. And there's a book here called From Horror to Hope by Barry Levy that has a very interesting last chapter about what we can do. And this one is all about what we can do. So public health is all about prevention of disease, prevention of disability, and promoting health, right? So why can't we apply it to wars and these kinds of things that produce injuries and death and disability? How can we teach this? Well, we're already doing a lot. It's not like we need to create a new curriculum. We can integrate and infiltrate, okay? Our research skills, our training skills, and everything we do, and epidemiological skills on topics related to public health promotion of war. So for example, the topic that I was talking about, militarism, peace advocacy, peace research, these are just some examples of competencies that we can address and we can include in our curriculum, okay? And as you can see, they are about structural, cultural aspects of conflict of war linked to morbidity, mortality, environmental consequences of militarism, nonviolent peace and anti-war movements, case control studies, and different kinds of research related to the relationship between militarism and health. We're already using some very interesting frameworks. So why not integrate these concepts into the existing frameworks in a public health education? So we talk about the levels of prevention, primary, secondary, tertiary. Can we include the primordial levels, which has been, cited by the literature as actually preventing the actual exposure to begin with, the cause of the cause. And this is, and one example is the root causes. And then the primary could be reducing exposure, nonviolent resolution, ending war to prevent adversity. And then of course, the tertiary is talking about rehabilitation of communities and nations. We often use the epidemiological triangle. Could we not also, when we're talking about and studying the epidemiological triangle, integrate these three important factors to include a discussion about violence? So people, military forces, and the context, which is the environment. The socio-ecological model we talk about a lot, and our wonderful students, have studied this and see it very well. And they are well versed in a socio-ecological model and its applications. Why not expand the socio-ecological model to include more of the global level forces, including the arms industry, including geopolitics, and think about that rather than just thinking about local determinants and local political determinants, and think beyond that and create this connection and understand this through critical thinking. And then here you could easily integrate migration policies, global interests, sectarian divisions, armed conflict, political instability at the global, regional, and national levels. They are already there, but why can't we add these? An interesting framework here that this book talks about is the complexity of the system. So, for example, you have in a complex system, this model tells us that there are different elements, but these elements affect each other. And the whole system changes when there are influences in the individual elements. So if you look at the top, the military, the governments, the war industry, the law enforcement, the justice and rights and public beliefs and values, and the media, all of these interact together to create an atmosphere or events or incidents of war. And then you have war, conflict, effects on war on civilians, on the infrastructure, on the families, climate change, etc. So I think this is something that we need to be thinking about beyond just the effects of war. Last but not least, and this is something that my colleagues referred to, is the pedagogies of service learning, for example, integrating our research beyond the IPEC, where you have students interact with medical doctors, medical students and nurses. Why not interact with political science students? Why not go beyond that to be able to do research that is not just in the area of public health, because we know this requires all our efforts, including promoting peace and preventing war, relates to and requires interdisciplinary action. So why not train our students to be able to work in an interdisciplinary team before they go out and they, so these are just some examples of assignments, research, and this has implications, of course, on us as teachers, and maybe we should think about that, but it's not impossible. And we can always use the literature that is out there, including articles, and there's a whole caucus on that in the American Public Health Association, and other ideas such as these from the books. We can do it. Thank you very much.
Any questions?
Comments, questions, suggestions, ideas?
For our colleagues on Zoom, you can write your messages in the chat box or raise your hands and mute yourselves and ask your questions.
Thank you very much for a very, very interesting and very, I mean, I feel we need more time to reflect on, sorry, I have no voice today, how all of these themes can be incorporated and all of these topics can be incorporated into teaching. I just had a question on peace and war. And, you know, you talked about militarism.
Peace and war.
So you talked about militarism and you talked about violence and weapons, but I think a topic that we often fail to address in maybe our public health teaching and in our courses is this buzzword, which is social cohesion, which comes to so it's not really leading to, I mean, it could lead to war, but it's really that kind of understanding the dynamics within different communities or within the same community and the tensions or possible disputes, and how public health practice can actually aggravate social tensions and community tensions between groups. And you know, we are still now mopping up the damages that all of the humanitarian action happened after the Syrian refugee crisis, with a lot of humanitarian aid only going to, let's say, refugees and creating much more conflict and tensions with host communities. And so how can we address that in our teaching? And I know there's something called conflict analysis, but it's always given in the context of, you know, the security kind of professionals, but not in a public health kind of context. How do we analyze these? How can we understand these different tensions and underlying disputes, or possible create, you know, additional aggravated tensions created by our interventions?
All right.
And that's my question.
Maybe we can take another question, Fadmara, and we can answer, or just to give a chance for people. Thanks, Grace, for your question. And before we continue, I just wanted to acknowledge Dean Sibai's support in sending us to this ASPPH meeting, which was very revealing, very eye-opening, and it gave us an opportunity to learn, but also for them to learn from us as well. Thank you. Joseph.
So thanks a lot. I agree with Grace that I think it needs time for reflection afterwards, but a really enjoyable and interesting seminar. It did make me think that, we aren't the only region facing massive forced displacement. And, now as we speak, millions of people are leaving the Sahel for climate change and trying to get to the Mediterranean or to the GCC or wherever they're trying to get to. The volumes of people on the move in the African continent are just, huge. So what are the schools of public health in, particularly the African continent, but other regions of the world? I know ASPPH isn't great in terms of being a venue for bringing it because they only usually involve the CIF accredited programs, but it might be something that would be really interesting to reach out to other schools of public health in other low and middle income regions, which are also facing similar issues, to see what can be learned and maybe, connections that could be made. I mean, wouldn't it be wonderful if we could get a grant that, our students could go and work in another region and students from another region come here? Because you spoke about the American students coming here, but I don't think we've had that many opportunities other than through the MCF program to bring students from other regions that are facing similar issues.
In the morning. Thank you, Joseph. Sosa?
War.
Oh, okay. I thought you were going to answer some.
No, but if we're taking a couple of questions.
Yeah.
I can respond to this later, but my question is, you know that in the 1970s, there was an anti-war, very 60s and 70s, a very strong anti-war, and the Alma-Ata explicitly talks about militarism and the use of resources. So my question is, currently, some scholars in the US are saying the same thing right now. And I'm wondering, are they acknowledging that they're not the ones who are coming up with these ideas, that anti-militarism in the context of talking about health has roots in the 1960s and 70s. And I just also want to say that I haven't read these books, but I know that Levy and others in the American Public Health Association have not taken any position on Israel, and they haven't supported Amy Hagopian or any of others in any activism about Israeli militarism. They've been supportive in other issues. So just if you have a reflection on this, I haven't read these books. I don't know much about them.
This is maybe more of a comment than a question, but to sort of link the two talks, like the previous one about hard skills versus soft skills, and now this one on preventing war and promoting peace. Maybe also we could conceptualize thinking this way as a soft skill, like thinking more politically, like you said, instead of less passively, like instead of just being a hard skill or a program competency, and like, oh, we should get more readings that are more like things that political science students would be reading or sociology students would be reading. Like that's important, but maybe conceptualizing it as a soft skill is also important. Like just in general in the courses, we could think more politically and think more about that sort of just line of thinking, if that makes sense.
We have one last question before you start answering.
Yeah.
Can I ask a question from the Zoom? Hello?
Yes, you can go ahead and ask your question.
Thank you very much. I'm Huda Zri, and this has been very interesting seminar. Gave us a lot of thoughts to reflect on. I would like to ask a very direct question to both Sausan and Tamar. As you were presenting, Sausan, you spoke to us about the newsroom, and you spoke to us about the debates that are taken up and discussed. And especially in the debates, you showed us only books in English. And I was wondering, and this came up with the essential skills of Tamar, to what extent is Arabic thought about as one of the essential skills? not only because students are going to be practicing in Arabic, but also because they have to read in Arabic in order to understand how people of the region think. Not everybody writes in English, and there are sometimes very excellent books that one can benefit from. And if they start that within their studies, this would be a good thing to follow. Now, I know that we have students who do not speak the language, but that's where we need you as a group to think about how can we not make it impossible for our students to really practice in their own language, read in their own language, understand who are the intellectuals who are writing about public health, about politics, about everything that impacts health in the region. So that's my question to you. Thank you.
So thank you. This was really quite an interesting seminar. And I want to concur with Southern's comment on the APHA, where it was not actually about the Israeli-Palestinian conflict. They've tried the peace caucus. They've tried for maybe 7-8 years to just get I don't know what they call it, a call or a resolution to pass it through APHA to consider the health of Palestinians under occupation. And it failed for 7 consecutive years. They couldn't get it through. So again, this brings me to the whole point of engaging in politics and advocacy. And the fact that scholars in general and university professors tend to be apolitical, either within the university or outside the university. There are certain criteria to meet, and they adhere to that. And that's quite a challenge. So just to let you know that after the Beirut blast, a group of AUB professors got together. It was founded, the Khaddit Beirut initiative was founded, leadership of Najat Saliba and Carmen Jaha. And then a group of us actually rallied around and did some work on that. There was a debate among the group that how can scholars, are we doing activism? Is that activism, and how can we move it forward? And one of us, Najat Saliba, in specific said, if we want really to change the system, we have to get out and be there in the political system. And that's when she decided to run for election. And now she's an MP, and she's been sitting in the parliament for 100 days as a sit-in with minimal support from faculty, from professors, or from the academic and non-academic. So there is a good disconnect. But then the Khaddit Beirut, we have transformed it now into a cluster under the provost office. And the cluster is named Sail for Change, Scholar Activism for Learning for Change. So we are bringing in the whole discussion of activism into the university. And I think you, as a group that is really discussing and thinking and debating the issue, could be part of that university-wide discussion. What does it mean to be a scholar activist? And how can we transform actually sort of criteria within the university to push that forward, just to keep that in mind. Nohad Yazbek is the director of this cluster. Yeah.
We have one comment from Diana Maddah on Zoom. She says that it is the best time for public health researchers to really employ the multi-sectoral approach coming from humanitarian emergency background. I guess a lot should be done, especially at the academia level, to strengthen and consolidate the advocacy effort toward promoting peace and digging deeper on the root causes related to each context. So now, ready to answer?
Actually, I'll just say just a few words saying that I think this seminar has started يعني sort of us reflecting and thinking, and this is, I think, very important. I don't think we have answers to all our queries, and these are just maybe questions to ourselves. And I saw the students nodding their heads on a lot of the comments that were given. And for me, I'll just say a couple of words on the which is just a few, and then Sausan, maybe you want to add or some odds. Okay, for the social cohesion. Okay, for the social cohesion, I think for me, it's a topic like any topic. And you can actually include it in anywhere you want in whatever course. So long as you design specific, if not learning outcomes, but sort of like assignments related to that, linked to the learning outcomes of the course. So it's that's how I think about it. So maybe I'm referring to the foundations course where the sky is the limit, but you can also maybe integrate it in the courses that you teach come in. And maybe Sausan has other thoughts on that. ما بعرف. But and I think, يعني, humbly speaking, that's how I think about it. So any topic, يعني, thinking about all of these, you can integrate them in epidemiology. You can integrate them in healthcare management, in whatever topic that, and it could be a cross-cutting come in. I don't know, but we can debate that. I don't have a quick answer, but this is just sort of my reflections on that. بالنسبة other regions and the reaching out, I definitely agree with you, Jocelyn, and I think there is a window of opportunity there. They're very interested in the connections with the other associations of schools, public health, other regions, but they told us we're the only region that that doesn't have an association yet, and we're probably working on that somehow. بشي طريقة, I don't know where, how. But it's on our radar, and I think it's a golden opportunity. And maybe in the 70th anniversary event, maybe we'll do something around that. But yani, that's definitely important. And Iman has reflected on the issue related to the Israel and the health of Palestinians. It's a big issue. So Anna personally, when I was there, I wanted to be political, but I didn't want to seem to be causing problems, because I caused a little bit of problem when I was talking to the CIF person there, right? So I didn't want to cause more, because I sort of like, told them my thoughts. So the debates, books on Arabic. Huda, thank you very much for raising that. And I'll leave it to my students to answer that question. But I have recommended in the undergrad and the grad courses that we teach in the program, and the department at least, to integrate assignments where students need to write in Arabic, do a transcript in Arabic, do a focus group in Arabic. And there has been a lot of reluctance and difficulty. And that's where maybe ChatGPT comes in, or Google, whatever it is. The Arabic thing, the translation. So that's very important, but it's not impossible, but there is difficulty because our students come in with very little skills in Arabic, and it's not their fault. It's the schools that focus a lot on English. So I think that's very important, and we see it. But there are also windows of opportunity, but it takes, group collective action to do that. And maybe buy-in from a few faculty members who they themselves might feel unable to integrate Arabic texts or the Arabic language into our teaching. Definitely let us know about if we can, the provost office. Tamar, Sausan.
Very quickly, I just want to say that I do assign a novel in Arabic in the first migration course. When I used to be rich, I used to give the students copies, but now I I give them a scanned copy of that book, of that novel in Arabic. And about you know, other regions that are experiencing similar. Absolutely, in the course we have content and we discuss displacement in Africa. We discussed Libya, the situation in Libya, for example. And in fact, we present what's happening in Africa and in Latin America as better case studies than what we have in the Arab region in terms of cooperation between countries, and at least meeting to discuss, some countries meeting to discuss the protection and rights of refugees, which is something that, you know, we don't have in our region. So we actually present Africa and Latin America in two ways, as also regions that have huge displacement, where, you know, there's a very thin line between labor migration and forced migration, but we also, they are presented as better case studies in terms of the legal aspects, the cross-regional, cross-country legal aspects. I just wanted to say.
Thank you for that.
Okay, just final point from my side. Definitely, this is on the agenda, the essential skills, and which includes the political skills, which includes, you know, conflict resolution at the level of intergroups, not interpersonal. On the agenda of the Graduate Public Health Task Force, we're going to work on this throughout the years on finding ways to integrate, evaluate, monitor throughout, and hopefully, you know, get to some impactful results at the end of our curriculum based on the feedback of students, feedback of our employers, but also, you know, moving along with the changing context, ever-changing context that we are experiencing around us. I think it's time, and it's important for us to be leading on this. And I want to even say that we are leading on this because we checked a lot of public health schools and public health programs, nothing reported. Even when we talked about this at the ASPPH conference, it was novel as an approach. So we're really proud to say that we're leading on this activity, and it is really important. The point on the Arabic, I think also working with Arabic in your profession as a public health professional is an essential skill. And I kind of, you know, we need to add that. And thank you for Dr. Srey for mentioning that. So thank you everyone for attending. Thank you.
And with that, we get to the end of this seminar. Thank you for our speakers, and thank you all for attending.